Alright, today we are testing shoulder extension range of motion. This occurs at the glenohumeral joint. You're going to have your patient laying prone on the table with their arm extended back behind them. The axis of rotation is going to be the greater tubercle of the humerus. The stationary arm is going to be aligned with the thorax, and the mobile arm is going to be midline of the humerus. You're going to have them go into extension. And she's sitting right at about 50 degrees of extension. Normal is 40 to 60 degrees. This motion occurs in the sagittal plane, and that is around the mediolateral axis. Okay. Today we're testing the pectoralis major at the clavicular head. The patient is going to be laying supine on the table with their arm abducted to 60 degrees and the elbow flexed. What you're going to do is you're going to have the patient pull their arm up and in, and you're going to be pulling the forearm out and down while supporting underneath the elbow. Okay, she can do that. This would be graded at a 5 out of 5. The muscle origin is the medial half of the clavicle. The muscle insertion is the intertubercular groove of the humerus. And then the muscle action is internal rotation, horizontal adduction, flexion, and adduction of the glenohumeral joint. Okay, today we are testing ankle dorsiflexion range of motion. This occurs at the talocrural joint. This occurs in the sagittal plane around the mediolateral axis of rotation. You're going to have your patient start sitting at the edge of the table with their legs dangling. The axis of rotation is going to be the lateral malleolus. The stationary arm is going to be the fibular head, and the mobile arm is going to be along the base of the fifth. You're going to have them go into dorsiflexion. So she is sitting right at about 18 degrees of dorsiflexion, but normal range of motion is 15 degrees. Okay, today we are testing the fibularis longus muscle. The origin is the lateral fibula. The insertion is the medial cuneiform in the first metatarsal, and the action is that it assists in ankle eversion and plantar flexion. You're going to have the patient sitting off the edge of the table with their legs dangling. You're going to grab their leg and support their leg by putting it on your thigh. You're going to stabilize at the back of their calcaneus. You're going to instruct the patient to move down and out with their foot. And then to resist, you're going to grab their foot and pull them in and up. This is at a 5 out of 5. Okay, today we're going to be testing cervical side bending. You're going to have the patient in a neutral head position. You're going to align the axis of rotation with the spinous process of C7. The stationary arm is going to be aligned with the floor, and then the mobile arm is going to be on the occipital protuberance of the skull. You're going to have them go into side bending. So she is sitting at around 42 degrees. Normal is 45 degrees. This occurs in the frontal plane of motion, and that is around the anterior-posterior axis. Okay, today we're going to be testing the obliques manual muscle testing. You're going to have your patient start in a supine position with their arms behind their head and their legs extended. Have the patient go into a curl as far as they can and rotate to one side. If the inferior angle of the scap can be raised off the table for at least 5 seconds with the hands behind the head, it is a 5 out of 5. If they have to cross their arms around their chest, that is going to be at a 4 out of 5. And then hands to their side is going to be a 3 out of 5 for 5 seconds. Alright, and then the internal obliques, the origin is the thoracolumbar fascia in the iliac crest. The insertion is the linea alba, the pubic crest, and the ribs 9 through 12. The action is it flexes and laterally bends the trunk, and the external obliques are at the origin of ribs 12 through 4. The insertion is the linea alba, pubic crest, ASIS, iliac crest, and the action is it flexes and laterally bends the trunk.